Good afternoon, distinguished audience. My name is Klenam Dzefi-Tetty from the Kolobu Teaching Hospital. I want to thank the executives of the International Society of Magnetic Resonance in Medicine for giving me this opportunity to make this presentation on MRI safety. The objectives of my presentation are to understand the biological effects of exposure to MRI fields, and also at the end of this presentation, we should be able to understand the safety issues of MRI. This is my outline. By way of introduction, the MRI scanner's main superconducting magnet is always switched on and very strong. Its strength is measured in Tesla. The MRI machines used in clinical practice are 1.5 Tesla and 3 Tesla units. 7 Tesla and higher MRI scanners are usually for research. And a 3 Tesla MRI machine produces a magnetic field around 60,000 times stronger than the Earth's. The strong static magnetic field in an MRI scanner is produced by a superconducting magnetic coil. This is placed on the very outside of the MRI machine and weighs several tons. The gradient coils, they also produce magnetic fields that give a uniform static magnetic field, a gradient in all directions in space. The body coils are also used. They produce the high frequency impulses and they receive the signals. There are also antennas, small coils that lie directly on the patient's body, depending on the organs that's being scanned.
Yes.
Usually, risks generally arise from three distinct mechanisms. We have the high static magnetic field, the gradient magnetic fields, and then the radio frequency magnetic fields. Safety issues to consider with a strong static field are biological effects and projectile hazards. Also, compatibility of implantable medical devices and compatibility of peripheral equipment. The biological effects of static magnetic field. You can have sensations of nausea, vertigo, and metallic taste in subjects exposed to 1.5 Tesla and 4 Tesla static magnetic fields. Higher machines with 8 Teslas may even cause changes in the heart rate and also induction of ectopic heartbeats. During an MR machine, the time-varying gradient magnetic fields are often switched on and off. So the human body has several excellent conductors. Like the nerves, muscles, and blood. The biological effects are related to the changes in the magnetic field that induces. The most studied phenomenon that is produced by fast-varying gradient fields is peripheral nerve stimulation. The time-varying magnetic fields induce an electric field which stimulates nerves and muscles, and this could result in involuntary twitching, especially in the periphery of the ball, where the gradient variations are greatest. This could cause muscle contractions or sensations of tingling and itching, depending on whether the stimulated nerve is a sensory or motor nerve. Peripheral nerve stimulation may cause discomfort to the patient, resulting in the patient moving in the scanner or possibly requesting the operator to stop the examination. Direct stimulation of the retina or the optic nerve can produce a phenomenon known as magnetophosphenes, and it occurs when retinal phosphines are stimulated by induction from time-varying magnetic fields. Magnetic phosphines can cause a flashing sensation in the eyes that, together with disturbance of eye-hand coordination, could affect the optimal working performance of the staff executing delicate interventional MR procedures. The TVMF also produces acoustic noise, which can reach up to 140 decibels for some sequences. Levels greater than 100 decibels may result in disturbance in microcirculation in the brain and produce mechanical damage. In MR systems, the spatial distribution of radio frequency energy depends on the design of the transmitter coils, the frequency, and the shape,
I'm
size,
trying to
and
call her
tissue
that I did
type
not
of
pick.
the
But thank God
image
they are just seconds.
objects.
So I told them they
Several
should
organs, such as
do them.
eyes, testicles, cannot quickly respond to heating, mainly because of their very poor capillary network.
Yeah,
Hence, they are
it is
under
what it is.
increased risk
I won't
of
kill myself.
thermal injury.
I know it is morning because of this lecture.
Other biological effects of radio frequency fields are that most of the reported incidents are burns due to hot spots in the presence of conducting materials close to the patient, such as the lease of equipment for monitoring physiological parameters like heart rate, blood pressure, oxygen saturation, and temperature. Now, safety issues related to the static magnetic fields. We know that most safety issues concerning strong static magnetic fields are related to the effects caused by the stray magnetic field. The portion of the stray static magnetic field that extends outside of the bore of the magnet is called the fringe field. This field is measured in Gauss units. The fringe field should be less than or equal to 5G at the outside perimeter of the room. The extent of the fringe field depends on the main magnetic field strength, the design of the magnet, whether it is open or a tunnel bore, and also the shielding. Is it active versus or room shielding? Projectiles, and one of the safety issues related to static magnetic fields. The strong static magnetic field can attract ferromagnetic metal objects, which can act as projectiles, also called missile effect. The strength of attraction is inversely proportional to the square of the distance, which means that the force quadruples as the object's distance from the ball is half. So the closer you are to the ball, the faster this occurs. A ferromagnetic object can reach speeds of up to 45 miles per hour on its way into a 1.5 Tesla magnet. Such ion-containing metal objects can become powerful projectiles and can cause serious injury or even death. Hence, all equipment, regardless of its function, should be tested with a strong handheld magnet of at least 3000 Gauss before it is used in or around the MR scanner. If the equipment is found safe after testing, it should be labeled as MR safe and used only in the MR suite. This is an example of a handheld magnet detector. It's about 1000 Gauss and found this on the internet. And it's also important to note that this cannot be used inside the magnet room, the room where the magnet itself is kept. This is another example of handheld ferromagnetic detector. This one also I picked on the internet. This one can be used in the MR room, and it can even be used where the magnetic strength is even 7 Tesla. It's quite expensive though. And then this is also available. I saw it on the internet, but this cannot be used inside the magnet or the MRI room. We also have wall-mounted MR metal detectors. I saw this also on the internet. These are mounted at the entrance of the MR machine room so that people can scan. If there's a mistake, this can beep and can alert you that you are having a ferromagnetic metal with you. We also have walk-through gate MR metal detectors. I saw this also on the internet. Some are even temporal. You can just fix it, or they can be permanent. And as you walk through, it will detect any metal that is ferromagnetic on you. It's sad that when MR started, this was the first fatal MR accident in the US, why a small boy was hit in the scanner by an oxygen tank. It's rather unfortunate. I saw this on the internet and wanted to share with you. Our hospital, Kolobu Teaching Hospital, we also has this unfortunate incident in 2010, whereby a patient unknowingly and unknown to the staff got to the entrance of the MR machine room whilst wheeling the father with wheelchair which is not compatible, and before the staff could realize there was this missile effect, the wheelchair was thrown into the MR ball, and the son was able to hold on to the father, so he was not hurt, but the wheelchair was thrown into our MR machine, and they later had to call experts to come and quench the machine before the wheelchair was removed. This was rather unfortunate. I have seen some other examples on the internet I wanted to share with you. This is another example. You can see the oxygen cylinder hitting this guy in the ball. Another incident I saw on the internet, and I gave it a code name, MRI machine is the bed which was um, attracted into the magnet ball. Now, because of all these safety issues, special equipment for the MRI had to be used. So the wheelchairs, the stretchers, monitors, oxygen tanks, IV pumps, they should be made of metals that are safe, like plastic, gold, sterling silver, titanium, and others. This is a wheelchair that we use in the MRI unit of the Kolibu Teaching Hospital. It's titanium. It's a metal covered with a plastic, MR safe. And then this is a special dedicated trolley we also use for the MRI. So patients that come at the zone 1, which after screening, we transfer them onto this wheelchair or the stretcher before they even get to zone 3, 2, and even 1. And the brain. So all patients with a history of metal-related eye injury or sheet metal work or welding that do not have positive confirmation of the absence of intraocular metal should be screened with conventional X-rays before undergoing MR examinations. Research has, however, indicated that metal fragments too small to be seen on the conventional radiographs, especially those 0.1 by 0.1 by 0.1 millimeters, are too small to damage the ocular. Most forms of medical or biostimulating implants are generally considered contraindications for MR scanning. But now they are manufacturing ones that are now MR safe. Several deaths have been reported in patients with pacemakers who have undergone MR scanning without appropriate precautions. But I must say that most of the pacemakers now are MR safe, but sometimes you have to be careful because the switches can be changed and then therefore cause difference in the functioning of the pacemaker. Now, what are the non-ferrous metals that are safe? We can use titanium, gold, silver, copper, brass, and aluminum. They are safe to go into the magnet, but always we need to test with the handheld magnet first or the other metal detectors, since they may contain parts such as screws that are ferromagnetic. Now, another important thing we have to talk about is labeling when we are considering safety issues related to the static magnetic field. In 1997, the FDA Center for Devices and Radiological Health first proposed terms to be used to label MR information for medical devices. At that time, devices were classified as MR safe or MR compatible. In 2005, the terminology was revised to adapt to the increasing variety of available MR scanners and to make it clearer than MR compatible devices. They are not necessarily MR safe. The current labeling categories are therefore, we now have MR safe, MR conditional, or MR unsafe. These are the three types of labeling that we now have. MR safe items. They are an item that poses no known hazards in all MR environments. So MR safe items are non-conducting, non-metallic, and non-magnetic. What is the sign or the symbol? The MR safe consists of the letters MR in green in a white square with a green border, or the letters MR in white within green square. This is MR safe. If you see this label on devices, then you know that this device is safe with MR. Then we have MR conditional. It's an item that has been demonstrated to pose no known hazards in a specified MR environment with specified conditions of use. The special conditions for use are determined by listing the acceptable static magnetic field strength, special gradient magnetic field, slew rate, time rate of change of the magnetic field, radio frequency fields, and then the specific absorption rate. So the MR conditional icon consists of a black inside a yellow triangle with a black border. So MR is written in a yellow background with a black border. These are MR conditional devices. Then the last one is the MR unsafe. This is the last labeling type, an item that is known to pose hazards in all MR environments. MR unsafe items include magnetic items. So how does the icon look like? It consists of the letters MR, this MR in black, is written in black, or white background inside a red circle, and then there's a diagonal band across it. When you see this sign, then you know that this device is MR safe and should not be brought near any MR field. So these are the three types: MR safe, MR conditional, and MR unsafe. These should be posted even on the walls in the MR units, and people should be aware of this, that the equipment they are having If they don't have any of this, if they have any of these labels, they need to know what to do. If it's MR safe, then it can go. MR condition, they have to check the conditions, and the MR unsafe should not be brought close to any magnet. There's another important thing that is useful in safety issues on, related to static magnetic fields. Zoning of MR facilities and workstations. The MR related space is divided into two categories. We have a control area. It's any area where the static magnetic field may exceed 5 MT, or where gradient or radio frequency fields may interfere with electronic devices. This area should be controlled by warning signs or other means in order to exclude people who may have pacemakers or implanted defibrillators or transmitters. Zoning of MR facilities and working stations. We have a restricted area as well as any area where the static magnetic fields may exceed 3 MT, and it should be restricted to qualified MR staff or people under the supervision of such staff. Ferromagnetic materials and anything which has not been shown to be compatible with MR equipment should not be brought into the restricted area. The controlled and the restricted areas of the MR site are also divided into 4 zones. We have the Zone 1. This area is freely accessible to the general public and typically is outside the MR environment itself. This is a place where patients, healthcare personnel, and other employees of the MR site can access the MR environment. Zone 2 is the interface between the publicly accessible and controlled Zone 1 and the strictly controlled Zone 3 and Zone 4. Typically, patients' movement in Zone 2 is not free and should be supervised by MR personnel. Then we have Zone 3. Zone 3 is the access to Zone 3 should be physically restricted by locks, passkey, locking systems, or any other reliable physically restricting method. Usually this zone is called the controlled area. Then the Zone 4. This is the magnet room where the MR scanner is located. Zone 4 should also be demarcated and clearly marked because of the presence of very strong magnetic fields. And this should be clearly marked with a red light and lighted sign stating the magnet is on. In Kolebu Teaching Hospital, this entrance leads into the Zone 4 where the machine is kept. And this is our MRI machine in the Zone 4. It's difficult to get access to this without being screened. The MR personnel, we have two types of MR personnel. We have level 1 personnel and level 2 personnel. The level 1 personnel, they are employees that need the basic knowledge of MR but do not work in MR on a full-time basis. These include anesthesia students, residents, physicians, assistants, floor nurses, ICU nurses, and others. These employees do not have access to MR. They need to be monitored by level 2 personnel. And level 2 personnel are employees that work full-time in MRI and have a vast knowledge of MR and the safety risks involved. These employees are in charge of making sure the MR area is a safe environment at all times. Examples of these employees are MR technologists, MR nurses, radiologists, and radiology students. Now, what are the safety issues related to the effects of gradient magnetic fields? The acoustic noise. MR noise may cause the patient annoyance, anxiety, so earplugs could be made available to anyone present in the imaging. Peripheral nerve stimulation is another effect of gradient magnetic fields, time-varying fields. In cases of peripheral nerve stimulation, the patient should notify the operator and the scan should be aborted. Heating of implants and other medical devices can also occur. Radio frequency electromagnetic waves can cause heating in metallic implants and foreign bodies by inducing a current. Without a pathway to exit the body, the current builds up and the implants get warm. The degree of warming depends on the strength and rate of change of the magnetic field and the conductivity of the implant. Heat stress can also occur. The human body has a very efficient thermoregulatory system and can handle reasonable changes in temperature. Even though the eyes and testicles have a poor capillary network and cannot quickly dissipate the heat by increasing capillary flow, the risks are believed to be minimal. Thermal burns. These can occur also. It's not very common, but they can occur, especially in patients who are sedated during the scan. Tattoos and permanent cosmetic composed of iron oxide or other metal-based pigments can cause reactions or adverse events, including first and second degree local burns. And also certain types of underclothing with antimicrobial silver microfibers have also resulted in local burns. So the best safety practice is to ask the patients to change into a hospital supplied gown. Also during the scan, the patient should be discouraged from crossing or forming loops with their arms to prevent the induction of current in the extremities. This was an example of an MRI burn I picked on the internet. It's very bizarre. Now, quench or cryogen safety is other MRI related safety issues that need to be considered. Currently, superconducting magnets use liquid helium to maintain the magnet coils at a temperature enabling superconductivity. The helium and magnet coils are maintained in a vacuum. The temperature of the liquid helium is approximately minus 269 degrees Celsius, close to the liquid helium boiling temperature. So any disruption to the temperature or loss of the vacuum will cause the liquid helium within the magnet to boil off, so-called, causing an immediate and sudden loss of the magnetic field. This event is referred to as quench. When this occurs, the helium will expand, and for every liter of liquid helium, 760 liters of gas will be produced. This marked expansion in volume causes the gas to rush out of the magnet and, under normal conditions, be vented outside the scan room and building. In the event of a quench, the patient should be removed from the scan room as quickly as possible. Although not immediate, asphyxiation can occur from breathing the helium. Additionally, because of the extremely cold temperature of helium gas, frostbite is also a concern. The quench produces a marked increase in air pressure inside the scan room, which makes it even difficult to open the scan room's exit door immediately. In the event of a large change in room temperature, ruptured eardrums can occur. So every site should have a written policy establishing what to do in the event of a quench. MR equipment, including examination room and any other areas where the coolant may be stored, should be installed with an appropriate exhaust systems to vent gases to the outside in the event of a quench. As a precaution in a case of quenching, an emergency evacuation procedure should be established and rehearsed by every MR facility. Oxygen monitors with an alarm audible in the control room should be in the examination room and other areas where coolants are stored. It is also recommended that emergency quench buttons be installed both inside and outside the examination room. This is an example of a quench situation I pick on the internet. You can see the helium gas coming out and the seriousness it is. Another MR related safety issue which we have to consider is contrast agent safety. Several gadolinium-based contrast agents have been introduced and more are in development. This is the contrast medium we use, gadolinium, in MR imaging. Adverse reactions have been relatively few and mostly minor, and cautionary notes are included with the packaging. Contrast agents should be administered with the same care and attention as any other pharmaceutical product. Some agents have been shown to cross the placenta readily, and when the rate of clearance from the amniotic fluid is not known, a careful assessment of the possible risks and benefits of contrast agents in pregnant women should be made. Caution should be exercised before administering contrast agents to lactating mothers, as some agents are excreted in breast milk. Patients who have previously reacted to gadolinium, all patients with asthma or a history of allergic respiratory disorders are at higher risk of adverse reaction, and they should be pre-medicated with corticosteroids and antihistamines. Another contrast-based safety issue is the occurrence of this rare disease called nephrogenic systemic fibrosis. It is seen only in patients with severely impaired renal function. The first case was observed in 1997, and the disease was formally described in the year 2000. A few weeks or months or even years prior to the onset of the disease, the patient had been administered gadolinium-based MR contrast agents. Literature suggests that 5% of patients with severely impaired renal function, that's those who have a glomerular filtration rate less than 30 mL per minute, treated with GAD will develop nephrogenic systemic fibrosis. And NSF is characterized with increased tissue deposition of collagen, often resulting in thickening and tightening of the skin, predominantly of the distal extremities, but also of the trunk, as well as fibrosis of other parts of the body, like the heart, lungs, kidneys, the peripheral vasculature, and then skeletal muscles. It usually occurs months or years after administration with gadolinium product. NSF is progressive and can be fulminant in approximately 5% of cases and can even be associated with death. The disease predominantly affects middle-aged patients with special predilection for patients with concurrent hepatic disease. This I have not come across NSF myself in my practice, but I picked this one, found this on the internet, and this is a patient. Clinically, you see these skin lesions with thickening and erythema plaques, very thick, and then the plaques, and CT scan shows this thickening of the skin and then the edema and then the infiltration. This is CT and this is MR of the thighs showing this condition. There's skin thickening, edema, and also fibrous strands. Based on the literature data, for patients with moderate to end-stage kidney disease, imaging methods other than MRI with gadolinium should be recommended whenever possible. Also, if these patients must receive a gadolinium, they should have prompt dialysis following the procedure. This should be considered because research shows that the average excretory rates of gadolinium is 78%, 96%, and even 99% in the first to the third hemodialysis. Also, special recommendations and guidelines are developed for patients with kidney diseases. The American College of Radiologists Contrast Committee and the Subcommittee for MR Safety recommends pre-screening of patients prior to the administration of gadolinium. In my institution, Kolebo Teaching Hospital, everybody has to have renal function and it should not be less than 30 mils per second. It is recommended that prior to elective administration of gadolinium, a recent at least 6 weeks GFR assessment be reviewed for patients. Now, claustrophobia, it can also occur, and some patients may experience claustrophobia even if they have no personal or family history of the condition. Claustrophobia is when patients feel anxious when they are in a tight enclosure, like in the ball of the magnet. This may be precipitated by the restricted space inside the MR ball, anxiety about the scan and the possible outcome, noise, and the duration of the examination. You know, MRI examinations are pretty long. Staff should be aware that claustrophobic reactions may occur and of the techniques which may affect them. They may have to counsel the patients and encourage them, tell them detailed things that will happen when they're in the MR machine. It is also important to have controllable air movement within the ball of the magnet to maintain a comfort zone for patients. Good patient contact and education should help also reduce claustrophobic reactions. Patient preparation involves many steps. The patient should be instructed to wear loose, comfortable clothing without zippers, snaps, or buttons. For most examinations, patients can wear elastic pants and a plain t-shirt. Female patients should wear a sports bra without hooks or wires. Any other type of bra should be removed before the patient enters the room. All accessories should be removed, example, rings, bracelets, watches, earrings, and body piercing. Face and eye makeup should also be removed. And if the patient arrives wearing clothes with zippers or other metal, he or she should change into appropriate gown. The gowns should have loose fitting sleeves so that the technologists can check for watches and bracelets. Loose sleeves are also an asset if the patient requires an injection of contrast medium. The patient's gown should not have pockets. It will be much more difficult for a patient to accidentally bring contraindicated materials into the room without pockets. So very, very important that all gowns should not have pockets. We also screen patients using the screening forms. This is an example of what we use at the Kolebo Teaching Hospital. We ask so many questions which the patients need to answer before we start. Example, a few of them are you or you have been a metal worker before, yes or no? Any prior injury to the eye, yes or no? Any prior surgeries and all that? Any metallic implants, when, what, all that are noted. This is what we. In conclusion, since the number of MR scanners is increasing in Africa, there is a growing need for understanding the biological effects of MR and for maintaining the safety of the patients and the MR personnel. While the effects of exposure to MR fields remain an active research area, clinical experience shows that MR is a safe imaging modality and that most of the risks are preventable by obeying the safety guidelines. These are my references. Please remember the magnet is always on. Thank you so much for your attention.